Welcome back. South Africa's healthcare system is divided between the public and private sectors, with only 17 out of 100 having medical insurance. And this highlights the deep inequalities in the healthcare system, as highlighted in the latest General Household Survey. The situation highlights the need for health and wellness business growth strategies for women entrepreneurs. And for more on this, we're now joined in studio by Dr. Jacky Hattingh, Dr. Stravos Nicolaou, as well as Zaz Molo, and they all join us now in studio for more on this conversation. And thank you so much for joining us today on this Women's Day.
Thanks for having us.
All right. And Dr. Jacky, I'm going to start off with you. I mean, just looking at that and reading, that statistic, 17 out of 100 South Africans with the access to medical insurance, quite concerning. And when you zoom that in and you question, the challenges facing women in South Africa, maybe just give us a picture of how deeply rooted those challenges are in South Africa.
Sure. So it is, I think, a huge concern, and South Africa is not unique in that sense that healthcare is often unaffordable, and not everyone has access to healthcare, and we're talking about primary healthcare. So we need to make it more accessible in South Africa, and for that to be more accessible, we need to cross certain barriers. So we have physical barriers, we have language barriers, and we have cultural barriers to overcome in order to make it more accessible for everyone in South Africa. And I think we can do, we need to shift our paradigm slightly if we want to overcome these barriers. It's easy to overcome physical barriers in the sense that we can make it available for people. We can take healthcare to people. We can bring people to healthcare by providing transport. This is all, from understanding that we can actually fund these kind of things. But if we want to overcome the other barriers, like cultural barriers, language barriers, we need to shift our paradigm slightly in how do practitioners interact with their patients. And we need to change our perspective slightly and be more patient-orientated. We need to have and spend more time with our patients in order to understand their unique environment, a personal environment. What is their diet like? What is their lifestyle like? And this is different to our current acute care model. This is looking at more a patient-orientated, integrative medicine approach.
Yeah. And, just listening to that, Dr. Nicolaou, and also just touching on, some of the comments being made by the president today, basically saying that, black and colored women are the hardest hit when it comes, to poverty 30 years later after democracy, and with a focus particularly when we look at healthcare. How does the pharmaceutical industry tap into that to try and help, the most vulnerable in our society, particularly when you're dealing with women?
Firstly, I think we need to acknowledge that South Africa has one of the most disproportionate disease burdens of any country in the world. We have the worst of what we would call infectious diseases, but now we've got a rising tide of non-communicable diseases such as diabetes, which is probably the most ominous of the lot, and then you've got cancers that are emerging. So you've got this collision of communicable and non-communicable diseases. And that's adding a significant strain and burden to the healthcare system, which is already an overburdened healthcare system. So what do we need to do? And I think there were many lessons learned during COVID. There was a lot of creative out-of-the-box thinking. Business got together and we worked closely with government. You couldn't distinguish between who was a public sector patient and who was a private sector patient during the vaccination program. You could go as a public sector patient to a Dis-Chem pharmacy or Clicks pharmacy and you'd be vaccinated, and vice versa. A public patient could go to Chris Hani Baragwanath and get vaccinated. So we need that type of thinking again. We can't remain in this isolated thought process or mindset that the private and the public sector operate independently and differently. So let me zero in on women specifically, because when you have such a disproportionate disease burden as we have in our country, what is critical is preventative healthcare. And this is where I think the pharmaceutical industry has stepped up quite nicely. So if I have a look at the cancers, which are the predominant cancers in women? There are three. So breast cancer is now the biggest. It's just overtaken cervical cancer because there's an HPV vaccine now, which has reduced the numbers of cervical cancer. And then the third biggest is colorectal cancer. Those are the three. But the first two are particularly problematic. And through screening, by way of example, you catch these cancers early, they are curable, or you can give the patient an increased lifespan that they would otherwise not enjoy if the cancer has developed or has metastasized. If it's developed to stage 4, then naturally the prognosis starts diminishing quite significantly. So you need to catch these cancers very early on. By way of example, Aspen, the company I'm representing here this evening, has just partnered with the Pink Drive, and we've put a whole mobile facility that does mammograms, it does pap smears, and all the rest of it. And this goes, and I liked what Jacky was saying, that you've got to bring healthcare to the people.
Yeah.
Right now the model is the people must go to the healthcare facilities, and the people don't have resources. I mean, I remember once being at a congress, and people said to me, but let alone not affording to pay the doctor or the medicine, I couldn't pay the taxi to get there, right?
Yeah.
So a mobile clinic of that sort, that type of thinking, if we're going to amplify that, that will make a massive difference, because the best way to overturn an overburdened, resource-constrained healthcare system is to improve the preventative care, and that's where we need to focus. And just a very last comment I want to make about female healthcare in general. We must never forget that something as basic as period poverty, or menstrual poverty, some people call it. Okay, what is happening is young girls are not turning up to school for 7 days because they're embarrassed, they're stigmatized, they're not pitching up for work. Their male counterparts are becoming more successful because they're not going to school. And then other problems start manifesting, other hygiene problems, like there's pelvic inflammatory disease, what we call PID. That's very often caused by bad hygiene, bad menstrual hygiene. Again, that can be prevented.
All right.
Okay, and you can get these girls back to school sooner rather than later. So menstrual poverty is a big thing we need to address in our country.
And I wanted to touch a lot on what you pointed out earlier on about the various diseases being faced by women, and that's where you come in, Zazine, when it comes to the wellness of women. I mean, Dr. Nicolau touches on, cancer, and of course, the wellness of women and the healthy lifestyle. That always comes into play in terms of the treatment of these diseases. With your organization, what is your organization doing in aiding women to recognize their health and wellness during this period?
Okay. Thank you so much for having us. I mean, firstly, I need to say that Empower Woman is a property of EmpowerWorks. We are in the business of impacting different people from different walks of life. And what we've been able to do is to bring specialists like your Dr. Nicolau and as well as Dr. Jacky to have conversations that are meaningful and also just impactful, to say where are the resources as far as the healthcare is concerned. And as well as if there are any policies that need to be changed, we bring women into the room to say, what are the challenges that we've been facing? What are the policies that need to be changed? And as well as, so that how do we also make sure that those conversations, they trickle better to get into the people that have the powers that be to be able to change and effect these policies? Because I think oftentimes we find women sitting together and talking about these things, but nobody in the room takes the conversation further to say, how do we make it impactful? How do we ensure that we are able to have it as measurable, to say, yesterday this is what we spoke about, and these were the solutions that we've been able to put in place place? And if the solutions that were suggested and be put in place, who's going to go ahead and implement those solutions that we came with? So Empower Women is actually that platform that allows for women and men who are policy and decision makers to be able to be in one room. As you can see, these are two sectors that are talking about healthcare, but from different perspectives. But in the main, what we're talking to, it is the healthcare that also talks to women. And as well as what are the opportunities for other women that want to get into these sectors, and how do they participate as well to make sure that we take the healthcare further than those that are in the room. Because as you've mentioned, we've spoken about how do we make sure that people that are not in the room are able to have access to the same type of these conversations and solutions that we're coming with as Empower Women.
And of course, Dr. Jacky, I mean, some of the barriers and challenges to healthcare keep on coming up, especially pertaining to women. And, with, the healthcare barriers, what would you say could be some of the solutions to assist women in our country with the challenges that they face?
I think when we speak to women, we speak to everyone really, because healthcare pertains to everyone in our country and in the world. And from my background and wanting to prevent disease rather than treat disease, because then we're really too late, I think the focus really needs to be on education. We need to empower not only women, but men too, to take care of their health. I think we need to shift responsibility a little. It is fine to look at our government and look at pharmaceuticals and look at our healthcare practitioners and say, fix me, I'm broken. But the responsibility really lies with each person. And we need to teach that from a young age. It is your responsibility to stay healthy. It is your responsibility to prevent health. But if you don't know how, then it cannot be done. And then you will always sit with a situation where we have to treat instead of prevent. So I think if we can integrate all of these different companies, not only pharmaceuticals, but there's a huge gap that we actually have to bridge between our current care model and a more patient-centered, integrative medicine model. So that gap, that's the gap that we need to bridge in order to help women and men to overcome their health difficulties and challenges.
Dr. Nicolau, earlier on, I mean, you touched on, during the pandemic and, the access to vaccines, where the public was allowed to go to whichever pharmaceutical company, or be it a Dis-Chem, be it a Clicks, being a healthcare facility, going to, some of the solutions government is looking at, like the NHI. What are your thoughts when it comes to giving access to everyone, including women, when it comes to healthcare in this country? Very short, we don't have much time.
Okay. The bottom line around national health insurance is that we have, again, a unequal, uneven private-public healthcare. So if you happen to reside in the public sector as a patient, you're going to be significantly underfunded relative to the private sector. Now, how do you resolve that? And this is what NHI aims to achieve, is universal health coverage, where everybody gets a good quality healthcare. How are we going to achieve that? And this is where the private sector is somewhat at odds with government, not entirely, but I think there's a strong coalescing around certain aspects. You need the private and public sector to work together in concert. As you correctly said, the type of model that we employed during COVID, and at the peak of vaccination, we had one of the most rapid vaccination programs in the world, COVID vaccination programs. So short answer is, we need to best leverage the resources, expertise and skills that sit in the private and public sector. And we need to leverage those to service the entire population. But most importantly, what I was saying earlier, we need to really step up our game in preventative healthcare and integrated healthcare, because we also have all these silo effects all over. And you've got to go to this specialist and that specialist, and very often the integrative part is lacking and the preventative part is lacking. We need to address those two, and we need to do so with gusto.
And Ms. Molo, to you now, when it comes to women leading a more healthy lifestyle, what would be your advice on this Women's Day?
I think my advice, it's quite an intricate one. I mean, the fact that we're here on Women's Day, it simply means that we really care about women's health. My advice, it would be really do come and participate as far as Empower Women is concerned. We are bringing different specialists in the room that are going to be talking about the wide range of women health, and who will be bringing some solutions into some of the issues that ordinarily we would not have conversations around. And it is, if you really would want to participate and be part of that, do join us on the 24th of August in Bryanston and Empower Women. It is going to be a summit like no other, where we are bringing really specialists, and not only just specialists, but people that are talking to your health to make sure that how do we make sure that the issues that women of South Africa have been struggling with, they have solutions to those.
All right. Thank you so much for coming in studio and for sharing those nuggets as we commemorate Women's Day. That is Dr. Jacky Hattingh. She is someone who specializes in natural medicine, as well as Dr. Stravo Senikolau, executive at Aspen Pharmacare, and as well as Zaz Molo from Health or head of Empower Women.